Hey, I wanted to make a video just to help you with the bones. This should be the second video you watch on the bones. Watch that one with just the PowerPoint first. But I did want to make a video of me holding the bones. And so go ahead and toggle up at the top and make, for this one time, make me big and the PowerPoint small. And so I have my bone paper out. And I have a room of bones and my skeleton here. And so go ahead and let's go down this list together. Okay, so if you're looking at the skull, you've got the frontal bone, it says, the front of the skull. On it there is a marking, I don't know why this blue thing's here, but on it there is, I can't really see it on this one, but there's a little hole right here, is supra, which is above the eye, supraorbital foramen. Okay, and then you also have, I'm going to go ahead and take this off, you also have two parietal bones, so frontal bone, parietal bone. Let's see, maybe I go to that slide. And then on the parietal bone you have the sagittal suture. Separating the frontal bone and the parietal bone you have the coronal suture. Okay, on the side over here you have the temporal bone, like your temple, and around the temporal bone is the squamosal suture. On the back is occipital, and this is your lambdoidal suture. Okay, so let's go over those bones again. Frontal, parietal, occipital, temporal. Okay, let's go over the sutures again, and you can see the sutures really good in that image. You've got coronal, sagittal, and then right here you can see the lambdoidal suture. Around the temporal bone is the squamosal suture. You can see that right there, the squamosal suture. Okay, on the temporal bone right here you can see that the ear hole is the external auditory or acoustic meatus, external auditory meatus. Okay, right here where the mandible fits, you can see, maybe you can see, I can't see what you see. So the mandible fits right there. That where the mandible fits is called the mandibular fossa. It's a flat area. These things that really point out and protrude out, they're called styloid process. Let me go right. That's inside, right there. Okay, so mandibular fossa, right here flat. Styloid process. Okay, the carotid canal is kind of tricky to see, but it's right here. It's not tricky on the picture, but it's, big and round. It's not big on this, but on the image it is. Perfectly round. If you look at it kind of in from, so here's a styloid process. It's kind of in from the styloid process, and the jugular foramen is just below it. And on this particular skull, the jugular foramen looks really large. And the carotid canal, it actually doesn't even look like a hole on this particular skull. But in the image you can see the carotid canal is in the image is like a perfect circle. And then the jugular foramen is just inside the styloid process. That one I think is kind of hard to see on the particular skulls we have here. Okay, so this is the temporal bone right here. The zygomatic process of the temporal bone. This is the zygomatic bone. Okay, mastoid process, this is big right here. Mastoid process is a large process coming out right here, but you're going to learn later there's a really important muscle that attaches called the masseter. But for now, just know mastoid process. It's just behind the ear. Mastoid process, large bumps. Okay, occipital is the bone in the back, the lambdoidal suture. Okay, there's really big hole that where your vertebra come out, your spinal cord comes out of your brain. This is called foramen magnum, and then on either side of the foramen magnum are these two condyles. They're called occipital condyles, and these are really cool because the first vertebra attaches right to it. Let me see if I can find one. Okay, so this is your atlas, the first vertebra, the cervical vertical one, and you can see where it would fit right on. Let's see if I can hold it where you can see. The flat areas will fit right on to that occipital condyle, just perfectly. So we'll get to that in just a second, but I did want to show you that. Okay, the sphenoid bone, look right here at the PowerPoint. Okay, you can see the sphenoid bone. It's going to be right here, but I don't see it labeled anywhere. Give me just a second. Okay, you can see it labeled here. It's inside the eye, but towards the back. And so the sphenoid bone, we think about it being here, right here, and then also we really think about it being right here too. So that was inside the skull, right there. And I was going to see, I know I have a picture of that right here. Okay, so this is the sphenoid bone, all right here. That's the inside. That's the inside of the skull. So I took this off, and that's the inside. Okay, right here, it looks like a saddle. Sella turcica, that's where your pituitary gland sits. Now listen, your pituitary gland, and we'll learn a lot more about when you take another anatomy class, but it sits right there, and it releases hormones. For this particular test, you want to know, not this lab test, but for this particular topic, you want to know that the Sella turcica holds the pituitary gland, releases growth hormone, makes your bones grow. So that's, on this topic. But if you look here, you can see the lesser wings right here and the greater wings. So these big holes right here are greater wings and lesser wings. Okay, the foramen, I know them, they're on the greater wing. I know them in order: rotundum, ovale, spinosum, lacerum. Okay, so let me show you the picture of them labeled here. So you can see rotundum is just a little tiny up closer to the top, and then ovale kind of looks like an oval, and then spinosum is just teeny tiny, little tiny spinosum, and then the lacerum, you can see it's kind of closer in. Okay, so look at the image on the PowerPoint. You can hardly see those little small things probably from the video. But the first one is rotundum, and then ovale, and then spinosum, real tiny, and then closer in is lacerum. And that's the sphenoid bone. Remember, sphenoid bone is like right here inside. It's also inside the eye, and then also just beside the temporal bone, you can see it. Okay, the ethmoid bone, you can also see from this side, the ethmoid bone right here. You have in the very center crista galla. Okay, and then the cribiform plates. Okay, and then the perpendicular is, if you see in the nose, this is called the vomer. Above the vomer, you can see, like it's kind of like the nasal septum inside there. Perpendicular plate of the ethmoid bone. Let's see, we have a nose up close. Right here, right here. So that right there, the perpendicular plate of the ethmoid bone. Since we're here, we'll do nasal, and then the center is vomer. I can remember, if you smell something bad, it makes you want to vomit. Reminds me of the word vomer. Okay, so we got all of the ethmoid bone, but think about the ethmoid bone being like the tear ducts. Okay, so if you look at this close-up of the eye, you can see the nasal bone, of course, is right here. Okay, and then superior orbital fissure or orbital, the optic canal, that's where the eyeball, the optic nerve goes back into the brain, the optic canal. Okay, and then the lacrimal duct, that's like the tear ducts right here. And then inferior is like a slit, long slit, inferior orbital fissure. And so really you have, let's see, there's a supraorbital foramen. Below the eye, there's a infraorbital foramen, but it's not on your list. Thank goodness, right? Okay, this right here is the maxilla bone, maxillary bone. It's got the palatine process. This down here is called the palatine bone. And then The incisive foramen you'll see is a hole right there behind your front teeth. Incisive foramen. Let me show you that on the image. So you can see the right here, the palatine process. Down here, palatine bone. I know that screws in the way. Palatine bone. And then right there you can see at the top the incisive foramen. Okay, so let's look at the next one is, of course, palatine bone. That's the palatine is like the roof of your mouth, your palate. Greater palatine foramen is the opening on the back of the roof. So right there. So if you're looking at your list with me, be sure and go down. You got the palatine bone, greater palatine foramen. That's the opening right there. And then palatine process, palatine bone, medial palatine suture, that's right down the middle, and then incisive foramen, that's that little tiny hole behind the teeth. Okay, so zygomatic bone is right here, that's where you would put your blush, and then the zygomatic arch, that's actually where the temporal bone meets the zygomatic bone. It's called the zygomatic arch. Okay, of course the lacrimal, that's your tear ducts, in front of the ethmoid bone. So nasal, lacrimal, ethmoid. Nasal, let me show you the picture. Right here, maybe. You can kind of see it there. This picture is going to be the best. You can see the nasal right here, lacrimal, and then you can also see the ethmoid bone. It's just not labeled there. Okay, vomer bone is right in the middle. I did that one already. Inferior nasal concave, that's inside of the nose. Inferior below, inside the nose. Okay, the mandible here, you have a little hole on the front. The whole thing is called the mandible. Little hole on the front is called mental foramen. This is the mental area. But I think about like, if you're thinking, you say, mental. Anyway, that's all I got. Mental. And then you want to know these things right here. You've got mandibular condyle. Mandibular condyle fits right in there to that mandibular fossa. Okay, coronoid. That has an N in it now. Put a pin in that. I'm going to reference that again. Coronoid, and then the mandibular foramen is inside. Okay, mental foramen is outside. Okay, again, we'll do the ramus is like that jawline right there. Mandibular condyle, coronoid process, mandibular foramen. Remember, foramen means hole. Mandibular foramen, mental foramen. The hyoid bone is just a little tiny bone. I think I've got one. Yep, right here. The hyoid bone is just a little tiny bone. Doesn't touch any, it doesn't articulate with any other bone. It holds the tongue, real small. That'd be a nice one to lay out. Say, name this bone. Hyoid bone. Okay. When you talk about your vertebra, the first one is called the atlas, and the second one is called the axis. Now remember, there are 7 cervical bones, and I have them. Oh, I got my skeleton here. What was I thinking? Okay, so there's 7 cervical bones, 12 thoracic bones. I think you can see this, and then 5 of the larger lumbar bones, the ones that really hold the weight. And so you can see 1, 2, 3, 4, 5, 6, 7 cervical bones. Those are going to all be in your neck. Now the cervical bones, the atlas is different than all the other ones. It's really special because it's the first one. And now the pointy part, that pointy part is called the spinous process. It goes towards the back. Okay, so it's posterior on all of them. This is the second one, the axis. I remember that they're in order. Atlas comes before axis in alphabetical order. So God really helped us on that one, didn't he? But you can see where the dens of the axis really fits right into the atlas. Nicely, like that. Okay. Okay, so 7 cervical vertebra. Atlas is the first one. It holds the head up. It has faucets, flat places, right, that articulate with the occipital bone. So we looked at that already. two transverse processes. Transverse processes are on the outside. Okay, the ones that have the pointy part on the front, they're called spinous processes. Spinous, so transverse, this one has transverse foramen. Transverse process, two holes are transverse foramen. Let me go to the vertebra. There we go. You can see that now really nicely. Okay, so transverse process, the holes are transverse foramen. The axis is second. The second one helps it to rotate from side to side. It has the dens or odontoid process. You can see it in the picture and right here that point upward and line up in the ring of the atlas. It has a bifid spinous process, so it kind of, can't really tell on this one, but kind of has two coming out. Okay, so all of the vertebra have these transverse processes. All of the vertebra have transverse processes, but just the cervical ones have transverse foramen. Okay, so these are the two holes on either side, transverse foramen. So C1 through C7. Remember, there's 7, 12, and 5 o'clock. Think about maybe you eat breakfast at 7 a.m., you eat lunch at 12, and then you 5 is when you have supper. Kind of an easy way to remember that. Okay, the thoracic ones, let me grab one. Okay, so these are all kind of stuck together, but maybe I can kind of point it out for you. The thoracic ones, you can see they have the spinous process. They have two transverse processes. The hole that runs through it is called the vertebral foramen. Okay, and then how they line up, let me show you. Okay, so remember, this is the back, right? This is the back. Okay, where they articulate, this is called superior articulating, and this is called inferior. So on this particular vertebra, this is superior and this is inferior. Okay, on this one, this is superior and this is inferior. So if you look at how they line up, this is not bringing me joy, all lined up like that. But if you look at where they touch, so on this particular vertebra, maybe you can see this, the flat place is called superior articulating process, and then on this one, on the bottom, is inferior. So the inferior of this particular one touches the superior of the next one. So hopefully that kind of makes sense. The spinal cord, we're going to talk about nerves later in the course, but it ends right around T12, L1, and so now you can see the lumbar are bigger, they bear more weight. Look at this one. Let's see. Right here. So you can see this body of the vertebra for lumbar is much bigger. Right, lower back weight holding. Okay, this is your sacrum. Hopefully this is helping. This is your sacrum. It's actually 5 fused bones together, and this is the coccyx. That's the tailbone. You hear about people breaking that. Let's see, here's your sacrum. Right there in both of those images. Okay, 5 fused bones together, and see it goes vertebra, and then your sacrum is right here. You know, in between the two coxal bones. At the end of your vertebra is your sacrum. The spinous process, it says long pointed projection right here. They will come out of the vertebra, the spinous process come out of the vertebra and then right into the sacrum. So where the sacrum is like kind of curved, that's your back. This is your towards the front of the body. Okay, so this is your back right here. You're looking at your sacrum. The superior articular process are going to be these two things on the very top. Superior articular process. The sacral canal is going to be, you can't see it here, but it's a hole that runs through. It runs through there on our bones. You can see it runs through right there. Sacral canal through the center spinal nerve right down the middle. Okay, tubercle of medial sacral. These are those bumps right there. Tubercle of medial sacral crest. Right, all of these bones. Tubercle of medial sacral crest. Okay, sacral hiatus is just above, that's like the very end. And this last part is the coccyx. The coccyx is 5 bones together. These are individual bones at birth, but all of the bones are fused together by age 25. Okay, sacral foramen, foramen means holes. So sacral foramen, sacral promontory is this flat area right here. Let's see, I think it's labeled there. So sacral promontory. Okay, moving right along. So the coccyx is 4 fused bones together. Some break in childbirth and, you know, throughout really. You know, but some of these will break when you have a baby. Sometimes your tailbone will break when you have a baby. Okay, so ribs. Okay, when you look at the ribs, let me show you. Here we go. Okay, so this is your sternum, and that's going to be next. Okay, but when you look at your ribs, if the rib attaches the sternum to the vertebra, then it's called a true rib. And we have 1, 2, 3, 4, 5, 6, 7 what we call true ribs. And then you can see, do you see where these 3 right here go together into cartilage? And then they go to the sternum. Those are what we call false ribs. And so there's 7 true ribs, and then false or inferior are 5. There's 3 that go vertebrochondral, 3 that go vertebrochondral, and then there's 2 that are just floating. And there's 12 on each side. Males and females have the same amount of ribs. That's like a myth or whatever. 1, 2, 3, 4, 5, 6, 7 true. 3 right here that go into cartilage false, and then you have 2 right here. Look at Mr. Skeleton right here. You have 2 that don't touch anything. They don't touch cartilage at all, so they're going to be floating ribs. I don't know if you can see this, but yeah, there's your true ribs. These 3 right here are going to go into cartilage. They're the false ones, and then the 2 floating ones as well. Okay, so look with me at your sternum. I had a sternum. Where'd it go? Here it is. Okay, if you look right here, manubrium, body, xiphoid process. The whole bone is called the sternum. Manubrium, body, xiphoid process. Okay, the clavicle, if you look here at the clavicle, do you see how one end is flat? The sternal end attaches to the sternum, and it's going to be flat, okay? And then you see how, look, the sternal end right here, and then it comes out to the acromial process, okay? So if you look, it's going to, you know, kind of touch right here, sternal end is going to be right here, and then your acromial end, we're not to this bone yet, but we will be. It touches right there on the acromial part of the scapula. Okay, so I want to point that out. If you look just at the clavicle, you have the sternal end, which is right here, flat end, sternal end, and then this part looks more like an S, is the acromial end. So let me pull that page up. Let's see. Oh, there was that. I should have shown you that when I did it. Okay, there's your clavicle right here. You have the flat end is the sternal end, and hey, guess what? It attaches to the sternum, right, just like that. Okay, and the acromial end is flattened this way, acromial end, and it touches the scapula, acromial side of the scapula. So that's your clavicle, and I wanted to show you kind of compared to that one, but kind of compared to a rib, you can see the clavicle is bigger, kind of like an S, so you can get that right on the test for clavicle. Okay, scapula. Okay, if you're looking at your lung sits right there. Okay, and so this part would be the back, you know, and you have the acromion process, coracoid. So it has a C in the middle. Coracoid. Remember, the mandible was coronoid. I just want to point that out. Coracoid. So acromion process. Coracoid, this is the scapular spine. Okay, this is the right here. This is the medial border. This right here is the glenoid cavity. The glenoid cavity, the humerus in the upper arm bone, that's not it. The humerus in the upper ulnar attaches right into the glenoid cavity. You can see there. Okay, let's make sure we got it all. So we have, if you're looking at your list, I'm looking at my list. Are y'all looking at your list? You have the scapular spine. Okay, superior border right here. I'm not going down the list now, am I? Okay, remember that A is on top of C. A, you know, in the alphabet, A before C. Acromion process, coracoid with a C, coracoid with a C. Okay, glenoid cavity, superior border, infraspinaeus fossa, right here, flat part, infraspinaeus fossa. Supraspinaeus fossa is just going to be, okay, wait a minute. We got supra on top, sorry, supra on top, infra on bottom. Okay, supraspinaeus fossa, flat part, and then infraspinaeus fossa on the bottom part. And then medial border right here, and then lateral border, that's on the axillary side, right, like the armpit side. Okay, so let's go. Yeah, hopefully you might want to pause the video and think about the scapula some more. I always, you know, want to remember acromion process, coracoid process. Of course, this is the spine, superior border, supraspinaeus fossa, infraspinaeus fossa, lateral border, medial border. So take a moment and memorize that. Okay, next we have the humerus here, and I'm looking at my paper as well. Okay, if you just grab the humerus, there's a larger indention on the back side. Okay, and so, you know, that's just kind of to help you out. This is the front side. Now, you always know that the head is going to be medial because it goes right in there to that socket, right? We'll do joints next time, but the socket, the head doesn't go out. No, the head goes in. And so the larger indention, just when you first glance at it, the larger indention is on the back. Okay, so this is your humerus. You've got head. This is like anatomical neck right here, surgical neck. You can see that in the picture. You can see, you know, anatomical neck is a little higher, surgical neck is a little lower. Okay, greater tubercle right here, lesser tubercle, so head, greater tubercle, lesser tubercle. Okay, in between, intertubercle grooves. Okay, deltoid tuberosity. Right here, this kind of bump on the front, we're going to learn later how that's really important for muscles. Okay. Rough V-shaped area on the lateral side of the bony shaft, it says. It's right, you know, right in the center of the bone where it's bumpy on the front, right on the front. Okay, olecranian fossa, that's going to be on the back side. Okay, on the very back side, the posterior back, the lateral end, that large opening right there, also pronounced olecranon. Okay, okay, you know this is the middle, medial epicondyle, lateral epicondyle. Okay, look right here. This right here is the trochlea, and this one is the capitulum. So maybe you can see that. Trochlea, capitulum, medial. That should say that slide should say medial epicondyle with an E. Lateral epicondyle. Okay, so from the top you have head, neck, surgical neck, right? You have both of the necks. Greater trochanter, lesser trochanter, right down the middle. Deltoid tuberosity. Okay, coronoid fossa, capitulum. Okay, olecranon fossa. Okay, so if you look, and maybe you can see the bottom of it here. The trochlea is like longer, kind of like, almost like a hitchhiker's thumb. Trochlea, and this is capitulum. It's because the head side is going to be medial epicondyle, lateral epicondyle. So this is the trochlea. Okay, if you flip it over, the large indentation is olecranon. Okay, on the front side, you'll see this is the coronoid. Okay, when you look, it's the cutest thing. Let me show you. This is your ulna, okay? And we're going to do the ulna in just a minute. But if you look at the ulna, it has an olecranon process. It fits right there to the olecranon fossa, right there. Isn't it nice? Okay, and it just, okay, olecranon process, coronoid, olecranon fossa, and look, it goes like that. And it's a hinge joint. It only moves one way. Isn't it just the cutest thing? Okay, so I think we have all of the humerus. Let's move to, I'm actually going to do the ulna because I'm holding it. So look at the ulna. You've got, for your ulna, you've got olecranon process. That's, look, this is a U. This is the ulna. Of course it is. Thank you. Thank you, God, for doing that for just for us. Okay, olecranon. Okay, the trochlear notch. Okay, you see this little flat area right there? That's the radial notch. Coronoid process. And then on the very bottom, it's like a pointy thing. Makes me think about like if you were to write on your iPad with a stylus. I don't know. It helps me. That's the styloid process. And the radius, which we haven't done yet, has a similar projection on the bottom, the styloid process as well. So those are both styloid processes. Okay, I want to go over the coracoid words. Okay, since we've covered them all now. On the mandible, okay, it's on the mandible, this is coronoid. Okay, on the scapula, coracoid, that's a C, coracoid. Okay, and then on the ulna is back to coronoid. So these two are coronoid. The C, look, jaw and ulna. The C is in the middle, okay? So coronoid, this guy didn't have a jaw. Okay, coronoid, coracoid, coronoid again. Turn your arm around, help me out, coronoid. Okay, I just wanted to point that out. I thought that would be helpful. Okay, let's do the radius. Radius looks like this. It looks like it has a button to me. The radius has a button. Okay, head of the radius, radial tuberosity. Let's go to the radius on the slide as well. We didn't look at this. Did you get the radial notch, that flat part? That's right where the radius fits. I mean, just look at that, the puzzle piece. The radius fits into the ulna at the radial notch. I mean, that's just adorable. Okay, radius right here. Okay, you've got the head, radial tuberosity is this bump, ulnar notch. It's actually on the posterior end. It's a flat area right there where it fits together nicely. These are the two bones in the lower arm, of course. I hope you already knew that. And then the bottom has a styloid process. Now let me tell you, when you're standing in anatomical position, which this guy's hand is not doing good for me. Okay, just move. When you're standing in anatomical position, the radius is on the thumb side. The ulna is on the side that you are on. So radius, thumb side, ulna, pinky side. So if you're standing in anatomical position, the radius is on the thumb side. The ulna is on your side, the medial side. Radius is lateral. Okay, carpals. I love the carpals. Isn't this fun? Okay, let me hold it like that. That's how the picture is. So first of all, you have these acarpals, then you have metacarpals, and then all of the fingers are called phalanges. You have 3 phalanges on every finger except the thumb. It only has 2. Okay, carpals, metacarpals, phalanges. Okay, when you look at the carpals, you can remember the big one, this big long one is, oop, I almost dropped it. Okay, scaphoid, lunate, triquetrium, and then this one right here is pisiform. Okay, and then come right here, hamate, and hamate kind of has like a little projection coming off of it. Do you see that? So it kind of, so pisiform is actually another bone right there. This one is called pisiform. I'm sorry, this one is pisiform. This one right here, maybe you can see this, is the hamate bone. I think that's an easy thing to tag right there. Hamate, capitate, trapezoid, trapezium. Okay, so we got scaphoid, lunate, oh man, I messed up. Scaphoid, lunate, traquetrium, pisiform. Hamate has a little hand hanging off. Hamate. So I want to be sure that you understand this is actually another bone. It's just stuck together for this model. But that is not. Okay, hamate. You can see it there, point to it in green. Hamate, capitate, trapezoid, trapezium. So the pisiform is like is attached right there to the traquetrium. Okay, and then remember, hamate has a little hook or a little hand. Hamate has a hand on it. Okay, look at the look at the coxal bone. The whole thing is the coxal bone, and then you can see the front part right here is called the pubis. And so there's ilium, ischium, pubis. Okay, but look how I wanted to show you how the two coxal bones fit together at the pubis, but then the two coxal bones also articulate right here with the sacrum. Okay, so you can see here that this is the hole that childbirth happens through, and so males will have a narrow opening right here, more so when females will have a larger pubic arch, is what it's called right there. Okay, so coxal bone, you have, let's get this just right. Here we go. Now we're working ilium, ischium, pubis. The cavity right here, this big area, that's where your femur fits. It's called the acetabulum. Acetabulum. Orbiter foramen is this big hole. Orbiter foramen. And the rest, you can see. Okay, so ilium. I'm going down the the list now. Look at your paper. Going right down the list, you can see the three bone parts. Ilium. Okay, and then if you're looking, so this is the front. This is the front, right? The pubis right here. The iliac crest. Okay, let me mention this. Ilium is a noun. That's the name of it. Iliac is an adjective. It's describing the iliac crest. Okay, posterior. That means it's going to be on the back. Posterior iliac spine. Anterior iliac spine. So above the pubis is right here, the anterior iliac spine. Okay, iliac fossa is just the flat part, or this whole flat part. Acetabulum, man, that's a nice place to put a sticker, right? Acetabulum, obtuber foramen, ischial tuberosity, that's that bump. That's where you sit, the rough area where you sit. The pubis is the front. Okay, let's move on. Oh, this right here, the sciatic, I didn't mention this. Ischial spine right here. You can see the sciatic notch right here, greater. This is like the opening. That's why when they give injections like antibiotic or steroid injections, they give it really high. They don't want to come anywhere close to on your booty. They want to intramuscular injection, but they don't want to get anywhere close to your nerves. So right here is your greater sciatic notch. Okay, take a break if you need it. I actually think I'm tired too, but let's keep going. Okay, so in your acetabulum is where the head of your femur hits. And I always tell people in class, if someone breaks their hip, they say, I broke my hip, I have to have hip surgery. They likely broke the head of their femur off, and they'd go in with a screw and put it back together. That's hip surgery. Okay, and so here's your femur. Now this big area, that's the back. Okay, so the smaller indentia is on the front. You know that the head is always going to be medial. You don't look like that. No, your head goes in medial, okay? So let's look at your femur together. You have the head, the neck. Okay, they got these two big bumps right here, this one and this one. This is going to be greater trochanter, lesser trochanter. So lesser trochanter is kind of medial. So head, greater trochanter, lesser trochanter. Going right down the list, on the posterior side is linea aspera. It's like this line right here. Linea line aspera. Okay, you know this is medial. So you have medial and lateral. Okay, so you're going to have the lateral epicondyle right here. Lateral epicondyle, medial epicondyle, medial condyle, lateral condyle. Let's do that again. If you're looking at it, if you turn it over on the back side, that may, let me move this right here. Okay, so this is going to be medial. So this will be medial condyle, lateral condyle. And then kind of up on top, medial epicondyle, lateral epicondyle. Okay, so medial, get the head side is medial. Both epicondyle, condyle. These are both lateral, epicondyle, condyle. Linea aspera is down the back. Greater trochanter, lesser trochanter, head. How are we feeling? Are we feeling good? I'm feeling good. Okay, this flat part right here is where the patella sits. This is your patella, it's your kneecap. Patella right there. Okay, let's move on. Okay, right here, these condyles, right? These condyles on the femur. This is your femur. I hope you can see it good. This is your femur. They're going to articulate right with the tibia. Now say that correctly, tibia. Okay, they're going to fit right there, just like that. And the patella, let's see if I can do this. It goes, patella, that's your kneecap, goes right there on the patellar surface. Of course the patella goes on the patellar surface. Some things are easier than you would think. Okay, let's go right there. There's your tibia. Okay, this part that comes down, like a part that comes down, that is medial malleus. Medial malleus. Okay, so if you're looking at the tibia, you can see, okay, medial condyles, lateral condyles, they fit perfectly with the femur, medial and lateral condyles. That's easy. You got that. Okay, tibial tuberosity. If you look, that's the bumpy area. So on the front is the anterior crest. Anterior crest. Right up here where it's this large bump is tibial tuberosity. Okay, so looking at your tibia, this one. Okay, you've got the medial malleus right here on the medial condyle side, right? Medial condyle, lateral condyle, medial malleus. So make sure you get all that part of the tibia. This right here is the tibial tuberosity. Okay, this, I already told you, fits right with the femur. Yes? Now, it also fits right with the fibula. And if you look at if you look at my skeleton here, you have tibia, fibula with an L. Now look at the word on the PowerPoint. Oops. Okay, look at the word F-I-B-U-L. It's L, it's little, and it's lateral. So tibia and fibula. Okay, if you're looking at it right here, let me show you. Here's your tibia. The fibula fits right down here. So this is the medial malleus. On the fibula is little lateral fibula. Now don't get that wrong. Fib, you tell a little fib is a little white line. Don't do that, but that help you remember it. Okay, fibula has the lateral, and they fit together just so perfectly like this. Let me show you. So this is medial malleus. This is lateral malleus. Okay, so hopefully you'll be able to get that right. This is two different bones, but it's medial malleus and lateral malleus. And the fibula with an L is on the lateral side of both legs, is on the lateral side of both legs, and it's little. Tibia doesn't have an L. Go back. People, I hear people pronounce it wrong, but you're not going to do that. You're going to pronounce it tibia. T-I-B-I-A. Tibia, fibula. Okay. Woo! Home stretch. Let's go. Let's go. Home stretch. The head of the fibula, let's see, articulates with the talus. Okay, so there's the foot. Okay, when you look at the foot, this bone that comes out right here is called the talus. It fits perfectly with the tibia. I almost forgot the name. I'm tired. tibia fits perfectly with the talus. Okay, now when you look at the bones of the foot, this big one, this is your heel bone, is called the calcaneus. This is the talus. Then you have the long navicular. You have three little ones in a row. 1, 2, 3, like the 3 wise men that visited Jesus is the cuneiform. 1, 2, 3. Okay, so calcaneus, talus, navicular. 1, 2, 3 cuneiforms. Okay, this one is cuboid, no D, no AL, cuboid. And that's it. Cal told Nora milk is like cream. So hopefully that will help. These are all tarsals, metatarsals and phalanges. Okay, listen, I hope that was helpful. I hope that you could see the skeleton and the bones. And on my screen, all I can see is the PowerPoint. I can't see me. So hopefully you were able to see, and hopefully this helps. It will help you study in addition to the other video where I just go over the PowerPoint. Good luck.